Good afternoon, everybody. I'm Priyanjali, your host for today's live from All About Skin Wellbeing team. I'm sure you all must be keeping good health. Today, we are going to discuss about our skin health, which focus on psoriasis. Psoriasis, a condition in which skin cell builds up and forms scales and itchy dry patches. Psoriasis is thought to be an immune system problem. Triggers include infections, stress, and cold. The most common symptom is a rash on the skin, but sometimes the rash involves the nails or joints. It can start at any age, but most often develops in adults between 20 to 30 years old and between 50 to 60 years old. It affects men and women equally. In today's digital world, it's a boon or blessing if we can get to hear from an expert dermatologist online about psoriasis and its types, how we can prevent it, the kind of tests required for its diagnosis, the right treatment, and a management approach for an early relief. So, ladies and gentlemen, girls and boys, we have with us renowned dermatologist of India, Dr. Shreyes S. Is an MBBS, DDVL, FRGUHS, and FAGE dermatologist, trichologist, and medical cosmetologist from Mysuru. He is a gold medalist in the field of dermatology and is currently practicing at Shreyu's Skin and Health Clinic, Mysuru. A warm welcome to Dr. Shreyas. It's a pleasure to have you with us today, and we are going to discuss on a very important topic, which is psoriasis. First of all, I would like to ask you, what is psoriasis, doctor?
Okay, thank you for the introduction. And so, coming to what is psoriasis? Psoriasis is a very common, chronic, inflammatory, recurrent disorder which affects mainly skin. But as you said in your introduction, it can also affect other organ systems, mainly the skeletal system. That is, it can affect the nail as well as it can affect the joints or the bones. So it is basically a polygenic skin disorder. That means there is a gene involved. So there are many studies which can link the psoriasis with a particular gene, that is through polygenetic studies, through HLA studies. So we have known that it is a chronic, recurrent and relapsing conditions, and it's an inflammatory disorder.
Right, right. So, doctor, the skin being the largest organ, there are a lot of things happening in our skin every now and then. So, we get to see a lot of changes, maybe because of any insect bite or people with sensitive skin, they see a lot of changes. So, how does one know in the initial stage that this is psoriasis? What are the early symptoms of it?
Correct. As we know that psoriasis can affect or can be present in any age group. Two peak age, the groups that is between 30 to 40 years of age, and one more is
Hmm,
in the second decade of life, around 50 to 60 years of age. So first thing,
right,
and as you said that it can usually come in any gender, be it male or female,
hmm,
or usually any age group. So initial phase or the initial lesion of a psoriasis usually affects any of these places. It may be the scalp alone, it may be on
hmm,
the palms and soles, or it may be
hmm,
other places like we usually see on the elbows, on the knees, or even on the trunk, that is usually in the back or over the abdominal areas. So these are the places where we see if we get to know any rash is present and that rash is thick, red, and scaly, then we usually can say probably it is the initial lesion of a psoriasis. So there are various
right,
types of psoriasis. Accordingly, the presentation can be there, and it can vary widely within the individual, and also it can vary from person to person. So within the individual itself, various types of psoriasis can coexist. So initial lesion
right.
will be a red papule or a plaque, which is usually raised above the skin surface, and it can be itchy. It is red and it is usually micaceous or a whitish scale which is present on the surface. So usually when the person scratches, you can see that the scale is falling off. So usually this points towards a psoriasis.
So, what causes this psoriasis, doctor?
Correct. So psoriasis, as I said, is a polygenetic disorder. That means in case if parents are having psoriasis, then the kids can get psoriasis. So
Hmm,
if both the parents are having psoriasis, then there is around say 50 to 60% chance of kids getting psoriasis. So if one parent is having psoriasis, it reduces to around 20 to 15 to 20%. If one sibling is having psoriasis, then it can reduce even further to 6%. But it is a genetic disorder that means it can pass from families. It can pass
Mm,
genetically. So there is a strong genetic association with this. And along with that, with the presence of a genetic factor, that means the background is a genetic factor, but the triggers can be many. So on the background of a genetic disorder, we have lot of triggers. So these triggers can start with external triggering factors. That means, for example, just a scratching or any injury to the skin itself can trigger psoriasis. So we call that as Kopner's phenomenon. So that is
mm,
even a sunburn, or someone is having a drug rash, or someone had a viral exanthem. So this itself can trigger a psoriasis. So these are all the external triggering factors. So there are some
right.
systemic triggering factors. For example, any infections. Most commonly we have the streptococcal infections like the sore throat. Someone might have a urinary tract infection. So these can trigger psoriasis. And sometimes we see psoriasis in a HIV positive a patient where it can get aggravated. There are some endocrine factors also. For example, we say hypocalcemia and vitamin D deficiencies. So these
Mm,
also can cause or can trigger psoriasis. And a very known commonest factor is the psychogenic stress. So the stress which will heighten the cortisol levels in the body during the stress disorders. And this can again cause psoriasis. Certain drugs can cause psoriasis. For example, lithium, for example, interferons, so anti-beta blockers. So there are some antifungals also which can trigger psoriasis. And definitely some habits like alcohol, smoking, obesity, all these factors can trigger psoriasis. So these are all the triggering factors, but the main pathomechanism is an interplay between the immune system as well as the genetic factors. So the genetic factors will trigger an abnormal immune system. Basically, our immune system is known to protect our cells or our body from invading microorganisms. But what happens in psoriasis? Because of this genetic issue, they tend to behave abnormally. So there is a wrong interaction between the so-called T cells, then the keratinocytes, and all other cells which are placed below it. So this abnormal coordination between the immune system is known to trigger or initiate psoriasis. After the initiation, then there is going to be a maintenance phase. So in this initiation phase, that there is an abnormal T cell. Now that will trigger the immune system through toll-like receptors, and that will start producing the interferons, and they will stimulate in turns the dendritic cells and the fibroblast. So this is how a psoriasis will start.
Well, very beautifully explained, doctor. I believe everybody has a clear idea of psoriasis right now. Moving ahead, doctor, is it contagious?
Now, this is a good question. That psoriasis is not a contagious disorder. What are contagious disorder? Contagious disorders are basically which are going to be infective. Of course, a psoriatic lesion has the highest tendency to get a secondary bacterial infections. That means if a psoriatic plaque is there or if a papule is there, so that can undergo a superficial super added bacterial infection. If there is a bacterial infection, then that can cause cross infections. But a psoriasis
Mm,
does not come from one person to person by touching, by shaking hands, by being together. So it is not a contagious disorder. It is just a genetic disorder. So it's an immune
right,
disorder.
right.
So there is no
So,
contagious disorder with the psoriasis.
right. So, doctor, as you mentioned that there is a genetic history behind psoriasis. So, for the people who know that their family, anyone from the family, maybe the mother, the father, they are suffering from psoriasis, what preventions can they take save themselves from having it?
Correct. So very important comes here. With the recent studies, we know that psoriasis is no longer just a skin disorder.
Hmm.
Psoriasis, in fact, is a systemic disorder, and it has got
Hmm.
a lot of association between food, your diet, your lifestyle habits, and your stressful
Hmm.
conditions. So all these are the triggering factors, like I said, for psoriasis. So just because your parents or someone is having a psoriasis, that doesn't mean that you can always get it. So there is
Hmm.
just, we are saying it is a chance to get it. That means so much percentage of things can happen, but the other percentage, what we mentioned, 30% may not happen also. So if
Hmm.
you maintain a healthy lifestyle, and if you take precautions, or if you get your consultation done at the initial stages itself, so then a widespread or a full blown psoriasis can be prevented. So very important is, if you're a known case or a very strong family history of having a psoriasis, then you need to avoid the triggers whichever is possible, which I previously mentioned. So it may be an repeated infections. So building your immune system is very important to avoid infections and avoid certain drugs. Probably if you are taking any drugs for any disorders, then you need to little bit be careful. So you can tell to your consultant or physician that certain drugs which have an association with psoriasis, if you are put on that, probably you need to tell to your physician that you have a family, very strong family history of psoriasis, so probably they can avoid it or give some other drug. So mainly the prevention comes with lifestyle modifications.
Right, right. And we always say that lifestyle modification can bring a lot of changes in your life. We are talking about psoriasis today, but apart from that, a lot of things can be better just with your lifestyle change. So just basic habits, maybe the things which you have been doing since your childhood, just doing those, not bringing a lot of changes in your life, can make your life very much easier. We are talking with about psoriasis today, and we are in discussion with Dr. Shreyes. Moving ahead, doctor, with the next question. Um, can psoriasis be cured completely?
Yeah, that's the question. Now psoriasis, like I said in the definition itself, it is a chronic disorder. It is a recurrent
Hmm.
disorder. Definitely, it can be cured, provided that, the thing is that, say for example, we treat a patient with psoriasis, and for
Hmm.
example, at the end of say 3 weeks or at the end of 6 months, we generally score a person with psoriasis using the body surface area, so and so percentage, and we also do certain scoring called PASI, that is the psoriatic area severity index, and also there is some
Hmm.
other scorings called the DLQI, that is the daily life quality index. So
Hmm.
initially, say the PASI score is very high. So we or the body surface area is quite high. So with the treatment, if the body surface area involvement has reduced from 90 to say 5%, so
Hmm.
in such a chronic disorder, we are very much satisfied that this patient has the burden of the
Hmm.
disease has reduced a lot. Although that with future treatment, he can even reduce it further, and that
Right.
itself can be considered normal for a patient who's having a severe disease. For patient
Right.
who's having a mild disease, he can be cured. But if
Hmm.
he is having a severe disease with lot of complications, like I said, that it is a systemic disorder. A patient with
Hmm.
psoriasis can have a stroke. He can have
Hmm.
cardiovascular disorders. Also, he can have psoriatic arthritis. So these are the
Hmm.
conditions which usually debilitate the patient. So
Right.
with such broad complications which are present, so bringing down or improving the quality of life of such patients in psoriasis itself is a huge success.
Hmm.
So
Hmm.
even though
Hmm.
that patient, for with treatment or without treatment, he might not have psoriasis for say 1 year, 2 year, 3 year. So here and
Hmm.
there he might get few plaques, or which can be managed without any, systemic treatments, or just with
Hmm.
lifestyle modifications, or just with topical creams. That itself, we consider it to be a good treatment success. So we are
Right.
looking in terms of these things rather than the cure as such. So someone who
Right.
is having psoriasis might have an itchy skin, just an itchy skin in the future. He might get. So he or she needs to know how to manage or keep the disease as least as possible. So that would be the best
Right.
thing to do in chronic disorders or recurrent disorders like psoriasis. So there are many
Right.
conditions in skin which are chronic and recurrent, and they need treatment for years together. So it is possible. It is possible for that is in the initial cases itself, if the treatment is initiated, and a good maintenance is done, then probably they can be disease free for rest of their life.
Right. Doctor, speaking about managing the chronic disease, how important is hygiene for psoriatic patients?
Yes. So now the thing is that we have one condition called the erythrodermic psoriasis. So we have various types of psoriasis, among which the commonest we see is a chronic plaque psoriasis, or
Mm,
psoriasis vulgaris, which is present throughout the body, which are large plaques. So these large plaques, they have an advancing border, and it is erythematous, it is red in color, and there might be some satellite lesions which are around the chronic plaque that says that the disease is an active disease. So there is a one more condition called the erythrodermic psoriasis, that the body is fully involved, more than 90-95% of the body surface area is involved. So since in psoriasis, what happens basically, that usually our skin gets renewed once in 20 to 30 days. That means from the
mm,
basal layer to the topmost layer and then exfoliate. So it takes around a
mm,
month or so. But what happens in psoriasis is that the scales are getting, that means it is hyperkeratotic. That means whatever this is supposed to happen, it is getting within 3 to 10 days. That means the scales are building up, the exfoliation is not happening properly. So there
mm,
the infections rate can increase, and we know that whenever the disease is active, the patients tend to scratch those lesions, so that will
mm,
predispose to infections. So since
mm,
the buildup is more, and also because these scales can be rich in protein, so there can be infections or infestations. So maintaining hygiene, will help to give a clear skin. So it is better
mm,
to, there are, we teach them to apply oil, to massage, to take Epsom salt baths, and all those things to keep those things under control. So maintaining hygiene is very important, especially in cases like erythrodermic psoriasis or pustular psoriasis, which is usually a severe form of psoriasis. There, the hygiene becomes very important.
right. Doctor, rich in protein, you mentioned. So, what kind of diet do we suggest our patients suffering from
Correct. So
psoriasis?
this itself is a very important topic. What we say, the psoriasis diet in psoriasis. So diet in
Mm,
psoriasis is a very good topic for discussion, and everyone should know it. Basically,
mm,
it is a pro-inflammatory disorder. Psoriasis is a pro-inflammatory disorder. That is, there is a lot of inflammation going on within the skin, and similar
mm,
inflammation can happen in other parts of the body. You see, inflammation can happen within the blood vessels. So there are blood
mm,
vessels within the skin. So the inflammation is happening there. So why is it red? Because there is a lot of blood vessels which is just underneath the skin, and
mm,
you can see it is visible through a dermatoscope or a mm, certain magnifying instruments which we see. So they're just under the skin. So there is a lot of blood supply going on in a psoriatic lesion, and there is inflammation. That inflammation can extrapolate to other parts of the body. If it happens within the coronary arteries of the heart, they can get predisposed to cardiovascular
mm,
disorders. If it happens within the blood vessels of the neurovascular system, then it can result in stroke. So these are the things. So it is basically inflammatory disorder. So what we need in diet is a anti-inflammatory. So most of the diet in psoriasis should basically concentrate on an anti-inflammation. That means, so what is the things you should avoid, and what are those things that you should eat. So basically, anti-inflammatory foods are those which is rich in fruits and
mm,
vegetables. So a diet which is rich in animal fat or animal proteins, they are very inflammatory. So mainly
mm,
for those who are suffering from psoriasis, if they can cut
mm,
down on non-veg food and shift over to a vegetarian, that too rich in,
mm,
fruits which are colored,
mm,
except except we say that certain citrus fruits can be avoided, like lemon, lime, pineapple. So these things can be avoided, but other fruits can be included. So the fruit
mm,
should be had as a whole. It should not be made as a juice. That means the
mm,
fiber should be retained. So
mm,
except that you can peel off the skin probably, but you need to have the fruits as a whole. Do not make it as a juice. So one
mm,
fruit, one fruit, two servings a day, or a
mm,
fruit eaten whole on an empty
mm,
stomach, probably, or
mm,
in between the meals as a snack, would be a very good anti inflammatory mediator. There can be certain veggies also added in the form of a soup in the evening,
mm,
and there are other foods like for example refined foods or refined or packaged foods which is rich in hydrogenated oils and carbons that should be avoided. White sugar or whatever the sugar which we use, that should be avoided, and all packaged foods and refined oils should be avoided. In general, dairy products like milk and meat are the things which should basically be avoided. Certain vegetables, probably like brinjals or these nightshades like potato, tomatoes, they are also need to be avoided. So other fruits and other foods can be consumed in moderation, which has a very good anti-inflammatory mechanism. So shift from pro-inflammatory to anti-inflammatory foods. That is the
great.
mainstay with reference to your diet in psoriasis. And also there are certain seeds which you can add, like the flax seeds,
Mm,
sesame seeds,
mm,
sunflower seeds. So these seeds, we can make it as a cycle. Okay, so seed rotation can be done weekly thrice.
mm,
So this seeds
mm,
can be sprinkled over your dry fruits, sprinkled over your fruits which you are eating, and you can consume it every day or weekly, twice or thrice. So these are the foods which you should consume basically when you're having psoriasis. And when it comes to lifestyle modifications, you can also do some yoga asanas. Okay, so this
mm,
yoga practice can help you to calm down your mind and also regulate your immune system. So there are
right.
some poses in yogas which you can try that will help you to control the blood supply and also help to control other organ systems also, because psoriasis can affect other organ systems like heart and brain. So this will
Mm,
help you to stretch the skin, stretch the your skeletal system and keep them well toned. So these things
right.
will help you a lot to get a cure or to avoid psoriasis or to maintain these things.
Right, right. Very beautifully explained again. Doctor, what are the treatments available for psoriasis currently?
Correct. Okay. So before we initiate any treatment, we classify the patients who are having psoriasis into mild, moderate, severe. And we also decide the treatment based on the body surface area. If the body surface area is very less, and if it is a mild disorder, then we start with topical treatments. So the topical treatments can be in the form of corticosteroids, it can be in the form of retinoids, it can be in the form of vitamin analogs. We have the preparations, and also we have the good moisturizers which contain ceramides. So these are the
Mm,
moisturizers in the form of not just the moisturizers which are available commercially, even just oils, like for example coconut oil, olive oil, tamannu oil. So these are the three oils which can be used to apply it on the lesions topically for a mild case of a psoriasis. So with mild psoriasis who are having very limited lesions, it can be maintained topically with these medications, but they need to be used for certain, and it should be done under the guidance of a dermatologist, because on a long-term use without the guidance of a dermatologist, they can cause certain adverse effects. So elevating, scratching or itching is one of the other treatment modality in case of psoriasis. So for that, taking mild warm baths, oiling your skin at least half an hour to 20 minutes before going to bath, and some epsom salt baths can give you some relief from itching. So in a moderate,
mm,
for example, if someone is not responding to mild disease, or if it is gone beyond the mild and gone into moderate to severe, then we need to, those are the patients where we need to start on oral or systemic treatments. In systemic treatments, we have a wide range of treatments. So we usually, there are some immunomodulators and some immunosuppressors which are there in case of systemic disease. But the systemic disease, before starting that, the patient needs to undergo certain investigations. Maybe there are some routine and special investigations that we recommend So following that, only then we are going to start the oral medications. So in oral medications, we have certain drugs like cyclosporin, methotrexate, apremilast, which are phosphodiesterase inhibitors. And recently, we have shifted from that, or probably apart from that, we have very more important treatments lined up, which is called biologics. But biologics
Right.
are treatment which are given where these lines of treatment are not working, or probably when it is a severe disease, when the patient is not getting control with the traditional methods of treatment, then we go into biologics. So, but these
Mm,
biologics are not the one which are easily available. It cannot be administered easily, and it comes with certain adverse effects. So, and those are mostly the drugs which are given as injectables in the subcutaneous tissue, or IV rather
mm,
than oral. So they are not that feasible for all the patients, or maybe not affordable for all types of patients. So we usually start with the traditional treatments along with the
mm.
lifestyle modifications, the topical treatments, and maintaining the skin barrier is very important. So there comes the
Right.
role of oils, massaging, and diet, all these things. So this is how we
Right.
grade the patient, and then we treat it accordingly.
Right. Doctor, maintaining the skin barrier again, you said. So, can the sun help in this case?
Yeah. Definitely taking a sun bath, or at least, now there are, various things that the sun exposure should be probably for 5, 10 to 15 minutes per day, and it should be
Mm,
well before like 7 to 8 p.m. initial rays of the sun. That would be the
mm,
proper time rather than in the peak hours between 11 to 3, where you have more harmful rays. So
mm,
it should be done initially, that is after the sunrise, for at least 10 to 15 minutes a day. This sun bath
mm,
can help you to increase your vitamin D naturally, and thereby helps to maintain your calcium levels, and thereby probably avoid the psoriasis, because the calcium hypocalcemia itself and vitamin D levels may make the psoriasis unstable. So these are the definitely, so a moderate amount of sun exposure per day can help to maintain, or it will help in healing the psoriatic lesions. That is also there. And
right.
we have certain treatments called phototherapy. So that is something similar to the puazol, where instead of sun exposure, we have the narrow band UVB rays that will help to elevate symptoms and help to clear those lesions which are stubborn, and mainly to help
Mm,
to heal the itching which is caused by psoriasis. So we have the whole body natural narrow band UVB therapy which is given, which is called phototherapy. So that is also one of the treatment, quite safe treatment we can say, when we compare to PUA. So that treatment is
mm,
also there in case of psoriasis.
right. Right. Doctor, what is psoriatic arthritis?
Yes, psoriatic arthritis is nothing but, or enthesitis is nothing but, arthritis and enthesitis. Enthesitis is where the ligaments or tendons join the bones. So initially, the
Mm,
patients with psoriasis, when it is severe, they can start with psoriatic arthritis. So most of the patients, at least 30 to 40% of patients, can develop psoriatic arthritis anytime during their period of psoriasis. So it initially involves the small joints of the hands, say probably
mm,
the distal interphalangeal joints, and the middle interphalangeal joint. So the distal and sometimes the proximal interphalangeal joints, that is the interphalangeal joint. These things, small joints. These are the things which are usually involved. So patient usually presents with swelling, deformities,
mm,
which we call dactylitis. They would not be able to do their day-to-day activities. So on seeing the hands, we can make out it is painful, it is swollen, and there is redness, there is warmth. So here also there is inflammation going on within the synovium, and the joints and the tendons, or the ligaments which is attached to the bones. So that we call it as a psoriatic arthritis. So psoriatic arthritis is a severe form of involvement of, or severe form of psoriasis. So psoriatic arthritis also can be dealt similarly with, like how what the treatment we are giving for psoriasis, the same treatment usually also holds good for psoriatic arthritis.
Right, right. Doctor, now let's talk about the triggers. What can make psoriasis worst?
Okay, so psoriasis was, for example, if someone is already having a psoriasis, now someone
Mm,
gets a throat infection, so someone gets an abdominal infection, someone has a urinary tract infection somewhere. So these infections will make the antigen antibody complexes even more worsen. So there
mm,
we have seen there is one type of psoriasis called gutted psoriasis. Now this gutted
mm,
psoriasis is supposed to be a very self-limiting psoriasis. That means with an infection it comes. Once the
mm,
infection is triggered, it's completely gone. So it doesn't come
mm,
back. So there is that type of psoriasis which is a trigger mainly because of the infections. So that is mainly the streptococcal sore throat infection. So that is one thing. And like I said, there are certain drugs. For example, if someone is having a psoriasis and they take a antifungal treatment, and there are certain psoriasis. There is one psoriasis called the inverse psoriasis. Inverse psoriasis is where it usually involves the flexures. So that is, it can involve the groin, it can involve the axilla. So basically, if someone takes a treatment for fungal infection and then they take an antifungal, then it can make it more worse rather than treating the
mm,
psoriasis. So correct diagnosis of psoriasis and proper treatment is very important because certain drugs which is taken for some other disorder can trigger psoriasis. For example, if someone is taking a treatment for hypertension, because this psoriasis is a very common disorder which is associated with comorbidities, that the patient can have cardiovascular disorder, patient can have hypertension, he can have lipid abnormalities. Dyslipidemia is very common in psoriatic
mm,
patients. So therefore, these things can also be present coexistent. So treatment for other disorders might, trigger psoriasis, especially lithium beta blockers, TNF alpha. All these things can trigger psoriasis. That is one more thing. And of course, like I said, stress itself, psychological stress, because the stress of psoriasis that itself can bring depression. Many people that having psoriasis, they can become depressed. So they're in depression because of the stress and psychological issues. They can again can trigger psoriasis in them. It
mm,
can make it full blown. And also probably, for example, like I said, many people are smoking, they have alcohol. All these
mm,
things, smoking and alcohol, are the two main things. Again, because smoking and alcohol will trigger, it's a direct known trigger for psoriasis. So smoking and alcohol consumption should be 100% removed if someone is
mm,
doing. So it should not be done. And of course, they cannot do it immediately. At least they have to try their best to come out of it, because it is mainly smoking and all will trigger the free radical scavenging system. So
mm,
it will be a stress on the body at the cellular level. And basically there is already a deficiency of the pro or the anti-inflammatory mediator. So pro-inflammatory, it will cause even more inflammation. So that is why alcohol and smoking should be avoided. So these are the
right.
commonest triggers which we see on day-to-day practice, and these are the things which we usually tell the patients also to avoid all these things. And sometimes there are seasonal variations also. We see psoriasis, becoming more towards the rainy and winter seasons. That is because of the weather changes. That there is no much of humidity, lot of dry air passing on, so that can
Mm,
pull up the moisture content which is already present. It's already dry disorder, so it can cause even
mm,
more issues. So usually the clothing, the way they dress up, and using moisturizers well, at least 2 to 3 times a day. If there are no good moisturizers, you need not invest in very costly moisturizers. At least coconut oil, liquid paraffin, okay, Vaseline, or sometimes petroleum jelly for
mm.
certain lesions can be used, which are at home. At least rather than wasting time, at least these things can be done.
Right, right. So, doctor, what about diabetic patients? How does psoriasis look in diabetic patients or patients with autoimmune disease?
Yeah, there can be certain overlapping disorders, or we say differential diagnosis.
Mm,
So that means there is no particular thing, as in that psoriatic can look like this in diabetes. But the thing is that since the diabetes itself is by itself is a lifelong condition, it's a chronic disorder. So the treatment becomes challenging when someone is having diabetes or when someone is having psoriasis. but they
mm,
can have frequent infections. They can land up in cellulitis because of scratching, because of repeated wound infections. So the wound
mm,
care is very important when it comes to diabetes. So it should be done side by side, hand by hand. We say in diabetes in general that hand and feet care is important, that they have to examine their hand and feet, uh, the patients who are having diabetes. So they have to just take extra precaution or extra care, uh, you know, to in people who are having type 2 diabetes mellitus. So otherwise,
right.
the treatment is challenging because there is lot of clashes, because a patient with diabetes might be on multiple drugs, three, four, five drugs at a time. So treatment
Right.
for psoriasis becomes a little bit challenging, and we might not
Mm,
be able to give them the 100% treatment which we give for a normal person without a comorbid conditions like diabetes.
mm,
So these
mm.
are the things, and
So,
people with diabetes might have some renal disorders. They might have chronic renal
mm,
disease. So there we will not be able to give them the treatment 100%. We will not be able.
mm, mm. Doctor, we usually hear patients suffering from psoriasis asking that how long will they need to take the medication? So, how long does the medication run
So
usually?
so I so ideally, how do we taper the medications? Ideally, we start the medications by doing initial investigations, and
Mm,
according to the drug or the medicine which we put, we ask the
mm,
patient to get the follow-up blood investigations, usually once in 2 weeks, once in 3 weeks, later on once a month, later on once in 3 months. So we
mm,
wait for the disease to stabilize. So how long?
mm,
There is no preset guidelines or preset timings that this should be the duration. It is all
mm,
individual. It is There is
right.
inter-individual variation on individual variation. So someone might respond within a month. So someone might take this with the same medications. It might take 3 months or so.
Mm,
So there is no preset guidelines that such medicines has to be taken for so long. The main thing what
mm,
we see is how is the plaques reducing, whether the erythema is reducing, whether the scaling is reduced. Even after reduction, we need to continue probably for another 3 to 6 months before taking a decision to taper and stop it.
right. Right. Doctor, also for the patients who tend to avoid or prolong such kind of chronic condition, uh, what are the other organs that psoriasis can affect?
Correct. So psoriasis can affect apart from the skin, because skin is the visible organ. So,
Mm,
and it's the largest organ, which is
mm,
having a wide surface area. So it is visible quickly. But whereas internal organs, it's not like that. Probably uh, till the
mm,
till it becomes very severe, we will not know it. So cardiovascular disorders are or myocardial infarctions are quite known. In case of psoriasis, there are many people that with a chronic psoriasis they have had heart attacks. So they might have stroke. So they might have other dyslipidemias. So this itself will
mm,
cause other system disorders, mainly cardiovascular and neurological. These are the two system, and of course we know that the psoriasis will affect even the bone. So these are the three organ systems. There is the skeletal system, the cardiovascular system, and the neurological system. These are the three systems where most commonly it is affected, apart from the skin.
right. So, doctor, we had a wonderful discussion about psoriasis today, and the detailing of the answers which we have received from you today, I don't know which we have ever talked such way
Thank you.
about this topic. So, it was a wonderful discussion.
My
Before we
pleasure.
take a leave, doctor, any take-home message for our viewers who has watched us so far?
Okay, so just I would like to anyone who's or who would have watched, would be watching this episode. So just be positive, like keep the hopes alive that it can also be cured with good lifestyle
Hmm.
modification, early treatment. Okay, of course your genetics should support it. That is one way
Hmm.
to talk about it. Go for a healthy lifestyle, that itself will cure half of your disease. Rest half probably will be taken care by the treatment which you are taking. So good lifestyle modification, good food habits, because we see that most of the diseases which we are having today in today's life is because of the food and the stress which we are having. So that if it is corrected, then most of your problems you can avoid it from getting itself. We always say prevention is better than cure. So that is more important. So there is a lot of treatments available. You can visit your nearest dermatologist and take the necessary treatments and keep it under control and be healthy.
Right. Well, thank you so much, Dr. Shreyas. It was a lovely, lovely time with you today. We thank you enough for your valuable time which you have given us today. Also, the session was very much informative for our viewers, and thank you, viewers, for your excellent participation. For more information and latest updates, you know what to do. You have to follow our page, all about skin well-being. We are also available on YouTube, Twitter, and Instagram. Stay safe and stay healthy. Thank you so much, everyone.